Everyone needs support at times. Building resilience and coming together is what strengthens our community. Child and Family Services Division remains committed to providing critical support and services to those in need. We strengthen families to enhance child development. We protect families against child abuse and neglect. We empower families to build resilience to cope with stress. We are Child and Family Services Division. We are here for you.
Hello, my name is Jamie Premdas, she, her pronouns, and I am the Children's Behavioral Health Bureau Chief in the Child and Family Services Division here at Arlington County DHS. Today, we are going to discuss an overview of our services and how you can refer and help families to access our services. But first, two of our team members are here with us and will introduce themselves.
Hello, everyone. My name is Carla Tercios, and I am the Court Liaison Behavioral Health Therapist here at Children's Behavioral Health. I help with intake assessments as well as participate in the truancy multidisciplinary team.
Hi, everyone. I'm Jennifer Gross. I'm happy to be here with you today. I have several roles in Arlington. When you all call to ask about services or make a referral for families, I'm the main person who answers our intake line 1560. I'm also one of the people that does our same-day access intake assessments, and I do a lot of trainings on the adult-focused child abuse, sexual abuse prevention programs.
Children's Behavioral Health is open. We are now offering our services in a hybrid model. We're based on clinician evaluation and family need. We are offering both telehealth and in-person options for families. The most important thing I think that we want to share with you today is that we are here to help, we want to help, and to be very honest with you, we're all proud to say we offer very good help. So please don't ever hesitate to pick up the phone and give us a call. 703-228-1560. We're going to be sharing a lot of information with you today, and we want to stress that we are flexible to meet the needs of our children and families. So as those frontline professionals who send us a huge percentage of our referrals, please don't ever hesitate to pick up the phone and call us. So as a quick overview of what we do, we offer our intake appointments. Same day or next day appointments are available. These are currently by appointment only. We used to have walk-ins where families could just show up and be assessed during the time frames we offered, but due to COVID and safety concerns and wanting to ensure the health and safety of our clients and our staff, those intake appointments are by appointment only. And the way to access those appointments is to have the family call 1560. We offer a lot of prevention and wellness programs that go hand in hand with some of our parent education and support. And I'd like to stress too that we are frequently schedule talks for parents, for PTAs, for a lot of the elementary schools have parent coffees, and we're happy, we have a standard set of talks that we offer, and we're also happy to come up with new ones to meet the unique needs of a certain population or age group. Our services include that clinical intake assessment, and at the end of the assessment, all families are offered help and advice to address whatever it is that brought them in for that assessment. Some families will meet our criteria to get services directly with us. And those services can include therapy, case management, discharge planning when a child is in a psychiatric or a residential facility, medication eval, psychological assessments, and then of course our behavioral intervention services, our BIS program. Same-day access incorporates a continuum of services that families and professionals can access. Families or partners can call 703-228-1560 with questions, to consult, to get more information, to strategize, to understand both the services the county can offer, and a lot of families have more options than just the county. They may have private resources or private health insurance, and we spend a lot of our time talking families through this complex and oftentimes overwhelming situations they find themselves in. So many times when we spend hours talking through with families, they make a choice not to come through us, and that's perfectly fine. But we are available as a resource to them to talk about the situation their children are facing and how they can get their children and their families some help. Many families will choose to get a clinical intake assessment with us. And again, as previously mentioned, right now we are not seeing walk-in clients for those assessments. We are scheduling appointments same day or oftentimes the next day. And we are able now to offer those either via telehealth or in person. Our scheduled intake assessments, the calendar is there. We offer them Monday, Tuesday, Wednesday, and Friday. And we are always available to talk outside of those hours during regular business hours. Please always leave a voicemail. If you call and no one answers, we are here during the day. We are working, but oftentimes we're on a call with another family or conducting an assessment. So please always leave a message and encourage your families to leave a message too. We are here to help any family in Arlington. The only insurance we take is Medicaid. So families with private insurance or with no insurance are assessed on a sliding scale. And we can discuss that more at length if you have, or if the family has, more questions about that. Here at Behavioral Healthcare, we often get questions from the community about who we wind up helping. And again, the answer is we do help everyone who calls. It's what we're here to do. And we can talk families and professionals through this continuum that we look at to assess during our intake assessments whether this is a child we're able to offer services to or not. Some of the factors we look at are whether the behaviors that are happening are age appropriate. And to share a real example that we've gotten many times over the past several years, we ask, are the behaviors age appropriate? If we get a phone call from a family who describes that their child, their son, is throwing food, throwing plates, throwing utensils, kicking, screaming, yelling, hitting, it's very different if they're talking about a 15-year-old versus if they're describing their 2-year-old's behaviors. And we do get families of kids, both those age ranges, describing those behaviors. That may seem like a silly example, but it's a real one. So are the behaviors or are the actions or words that they're describing and concerned about, are they age appropriate? We look at, was there a precipitating event? Was there some type of traumatic event? Is this an ongoing chronic situation? And when did that event occur? If there's been a death in the family and it just happened 2 weeks ago, families will call really upset that a child is clingy, that wants to sleep in bed with them, that is incessantly asking about death and are they going to leave them too. Those are worrisome and concerning, but they're normal, appropriate behaviors when a child has just suffered a great loss. Now, if those behaviors, if everything I just described is still happening 6 months after a death, then it's more of a concern. The frequency and duration of what's happening. 99% of kids are going to get upset, are going to get angry. But if that's happening once every few days, once a day, but lasts for just a little bit, it can be on the range of continuum of normal behaviors. If it's constant and lasts for hours and the outbursts are happening frequently, it raises the level of concern. And then functional impairment. Oftentimes we'll get calls from families who say, you know, my child has ADHD, but they're doing well in school. Their grades are good. The family's managing it with behavioral techniques, and maybe some families choose medication and their child's doing well. We are here and available part of our assessment is to assess for functional impairment. And so if a child has a concern, but they're dealing well with it and they're functioning well, we can help link the family to someone in the community, a provider in the community. But we are here to help children where there's a functional impairment in one domain, at school, at home, or in the community. So these are just some of the things we look at, and please remember that every family is unique and we treat them as such.
During the same-day access intake assessment, the intake clinician is focusing on various areas during the clinical interview. We're looking at the reason for seeking treatment, any precipitating factors, the onset and duration of the problem, so when did it start and how long has it lasted, any specific psychiatric symptoms and behaviors. We want to see what is the impact that this is having on the daily functioning of the youth, as well as their motivation and ability to participate in treatment. We look at substance use as applicable, as well as their risk of self-harm, suicide, homicide, and harm from others. We utilize other assessment tools that we will review on the next slide. And lastly, we look at formal and informal supports, as well as strengths for this youth. When a youth and family participate in a same-day access appointment, they can complete many or some of the assessments listed on this slide. Our intake assessment, which can be completed virtually or in person, include our clinical interview of the youth and/or family, the risk assessment, which is the Columbia Suicide Severity Rating Scale, our substance use assessment, which is the CRAFT 2.1N, also the ASAM as applicable, and the Daily Living Activities Functional Assessment, also known as the DLA-20 as applicable. Our financial assessment is completed by one of our customer account specialists, and our medical assessment is completed by one of our nurses. We would like to remind everyone that any Arlington resident may seek services from us despite their income. If we are not able to provide services for any reason, we will ensure to provide proper referrals to the youth and family. Clients are assessed on a sliding scale fee. We do accept Medicaid. The youth and family must participate in the referral process. A diagnosis is not necessary to make a referral. The intake staff will assess for any diagnosis. However, any information that can be provided prior to an intake assessment is very helpful and welcomed. Families can provide digital signatures to authorize services, and there is no wait list for children's behavioral health care. We would love to hear from you, so please do not hesitate to contact us with anything you may need.
As a professional working with the family, how can you best help the family? Number one, and most importantly, please call us and give us a heads up if there's a family that you have referred to our line. And in order for us to be able to share information with you, we must have a release of information. Many times, another professional will call us and they get upset when we can't share information without a release of information. Please remember, we are oftentimes as equally upset with that because we know that you know this family in ways that we don't, and the information and your observations and your clinical judgment is so critical to us being able to work as a team to help the family. But we cannot and will not share information without a written release of information. The county, various departments in the county did come up with a multi-party release, and that's the best one to send to us. Please, when you fill that release out, please put Child and Family Services in the to line, or the line where with whom you're going to share information, because if you put a specific clinician's name, that is the only person you'll ever be able to speak to. And in our department, we have the intake line, who's oftentimes different than the person who does the clinical assessment. And if the family is assigned to work with a therapist or a case manager, that will be a third person. So with the simple line that says Child and Family Services, one release will suffice. Number two, if you can share information prior to that appointment, prior to that assessment, it's incredibly helpful. So many times families come to us and they're overwhelmed, they're scared, and they oftentimes think, well, I told my doctor all of this, so this person that I'm meeting with must know. And we don't. We only can go on what the information that the family is telling us in the interview, which is why it's so incredibly helpful when we get a call from the schools, from the doctor's office, from another therapist, to share the reasons why they are referring the family for assessment. And it goes without saying, please have shared that information with the family as well. Sometimes families come to us and they don't know why they're being referred, and then we complete our assessment and the referral party calls back and says, you know, I'm surprised they didn't meet your criteria because of X, Y, and Z. And we were never told X, Y, or Z by them or the family. So the more we can communicate prior to that intake assessment happening, the better we're able to help families and children. The third important piece to realize is when referring a family or preparing a family for the referral, please stress that this is, when they call, it is not a first appointment for therapy. It's an assessment to see how we can help them. And we have a whole wide variety of programs, and our programs have been expanding a lot in the past several years. And so the best way to help a family is to let them know that by calling that number, they're going to be accessing a whole range and continuum of possible ways that we can help them. And I will tell you that if you want to, many times I've worked with schools, we've worked with schools where we've set up a Microsoft Teams, a Google Meet, or a Zoom meeting with someone from the school, our intake department, and the family to discuss, to do this step 3, to kind of discuss things through and talk about what possible options are. So we're always happy to available to do that as well, or to set up a phone call to help talk the family through that. And then number 4, it's really helpful when we've talked with you or you're talking with the family to help support the family with the right level of services. So while we are here and working every day with families, we do not conduct the emergency crisis assessments. That's either CR2 or emergency mental health. When we get a call to our intake line, or even when we're working with families long-term on our own caseloads, if we think the child is at risk to harm themselves or others, we link them to CR2 and emergency mental health. And that's different than just coming through our same-day access assessments. Again, we really want to encourage you. This is a lot of information. Every family is unique. Please just give us a call and we can strategize and help figure out the best way to help you help the family.
The following contacts can be very helpful for our youth and families. Emergency services, which is available 24 hours a day, 7 days a week, can be contacted when youth are at risk of harming themselves or others. Children's Mobile Crisis, also known as CR2, is available 24 hours a day, 7 days a week, and they can be contacted when youth through age 21 are in crisis or having an emergency. Children's Behavior Health Care, which is our main intake line, can be contacted when there are concerns about the youth's mental health and/or substance use. Crisis Link Regional Hotline is available 24 hours a day, 7 days a week, and they can be contacted via phone or text. And this is for when a young person wants to connect with someone right away. And although suicide prevention is their primary mission, they do encourage people to call for any reasons related to their mental health. The Trevor Project, which is available 24 hours a day, 7 days a week, can be contacted via phone or text. This is for when a young person needs to talk to someone right away, and they are the only national crisis intervention and suicide prevention lifeline for LGBTQ youth. Also, feel free to visit our website at www.family.arlingtonva.us. Thank you so much for taking the time to learn about what we do and the services here at Children's Behavioral Health Care. We look forward to working together. Please do not hesitate to contact us with any questions or anything you may need. We can be reached at 703-228-1560. Thank you again and have a wonderful day.